Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection Series. Today, we have our dear Lucy. Thank you, Lucy, you're so good. And a guest speaker talking about the dangers of addiction. Our guest speaker today is Jenna Labell. And Jenna received her master's degree in counseling psychology from McGill University in 2017. She's currently in the final year of her doctorate in clinical psychology at the University of Montreal. Prior to pursuing her doctoral degree, Jenna worked as an addictions counselor in an outpatient rehab center with adults and youth suffering with substance dependence, as well as behavioral addictions, cyber addiction, gambling addiction, sex addiction. She is currently completing her doctoral internship at the Montreal General Hospital in the Allen Edwards Pain Management Unit, where she works with individuals suffering from chronic pain. Now, Lucy, in case, there is one person who hasn't been with dear Lucy before. Lucy has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. In addition, in a personal note, Lucy would like you to know that she was a caregiver for her own mother for about 10 years. And with that, Lucy, Jenna, welcome.
Thank you so much, Evelyn. Good morning, everyone, and really welcome. So I just want to say, for those who would like to ask more personal questions about addiction, we're offering an extra half hour at the end of the session. What we're going to do is we'll stop the recording and you can change your name on the computer to remain totally anonymous. It'll give you a good opportunity to just be, feel free to ask any questions. As well, I want you to know that you will be receiving the slides, and we do have a slide for resources and Evelyn will let you know how you can get those at the end of the session. Okay, so today's next slide, please. So today we wanted to bring awareness to a subject that is often not talked about, yet touches so many people and their families, that being the topic of addiction. First, we will provide some information about the difficulties of caregiving and why caregivers may in fact be a population at risk for struggling with addiction. Then our guest speaker, Jenna Labell, will go into more details defining what addiction is, how a person can become addicted to a substance or a behavior, the signs and symptoms of addiction, and some information on what to do if you want help in changing. Next slide, please. So we know that caregiving can be very rewarding for many reasons, but we also know that caregivers experience a lot of difficult emotions in the process of providing care. Many caregivers feel frustrated, overwhelmed, angry, sad, and resentful. These feelings can have a serious impact on your physical and mental health, especially if you have no outlet for those feelings. As a family caregiver, the focus often is on everyone around you, especially the person you are caring for, the difficulties and pain of their realities. Some people use substance to try to self-medicate their symptoms of depression or anxiety. And in the short term, people might find that it works, meaning it dulls their symptoms. However, long-term use of substances can actually increase anxious and depressive symptoms and ultimately make these conditions much worse. This is why substance use is considered a maladaptive or harmful coping mechanism. There exists specifically a lot of research on the ways in which long-term use of alcohol is related to increased depressive symptoms. Next slide, please. So now we also know that many caregivers don't identify themselves as caregivers. They see themselves as either wives, partners, children, or family members, which they are. But they can also neglect the fact that they are in a unique and difficult role of caring for a loved one, which is not an easy job. Some caregivers do not take care of themselves. We know that. They push off seeing a doctor, don't sleep enough, have poor diet, lack exercise, and many isolate themselves from family and friends. So according to the National Alliance for Caregiving, 44 million Americans serve as caregivers to people with disability or illnesses, and about 10% of these caregivers are thought to be substance users. Another statistic shows that almost half of family caregivers take more medication than they did prior to assuming a caregiver role. And I have to say that I was quite shocked by all of this research, and it is quite overwhelming. So the question is, what may lead a caregiver towards substance abuse or addiction? Well, first, we talked about it. Stress is a major risk factor for developing addiction problems, as well as for relapsing if a person has been sober. As we have mentioned, caregiving is a very stressful life circumstance that often changes families' dynamics and leads to an increase in responsibilities for caregivers. Other reasons for why caregivers are at risk for addictions of substance abuse is due to anxiety about how well they are managing caregiving duties, as well as fears about the future, stress from juggling so many responsibilities, lack of time for their own self-care, increased feelings of sadness and depression from watching a loved one decline. A lot of them have body pain from physical demands like lifting a loved one, or from other pains related to illnesses, isolation, and feeling totally alone and disconnected from others who feel that they may not understand their reality. Resentment from other family members, possibly, who don't help, anger at being placed in such a difficult situation, especially if your relationship was never a good one, as well as possibly long-standing unhealthy family dynamics playing out and resurfacing a family trauma. So other risk factors of struggling with substance abuse or an addiction that are not only specific to caregivers, but apply for most people include: there could be a history of addiction in the family. For example, if someone's parents suffered from addiction, that puts their child at a greater risk for struggling with addiction as well. However, this is not a one-to-one scenario. Not all people with addiction in their families will become addicts themselves. It simply means that they are at a higher risk than others. There could be a history of trauma, puts individuals at greater risk for struggling with substance abuse. Trauma means having lived through various difficulties and making events that might still have an impact on the person today. So you could have suffered that when you were a child, but you haven't dealt with it, and that trauma is still there. The earlier a person starts using substance can have an effect on their level of risk to becoming addicted to a substance. This is because the brain is still developing up until age 25. So the earlier a person might start, the more it may have negative effects on brain development. So suffering from other mental health conditions such as depression or anxiety increases a person's risk of struggling with substance abuse or dependence. So this presentation will give you an overview of addiction, and you may or may not recognize yourself in some of the topics that we will mention. It's important to prioritize your own physical and mental health so that you can be there for yourself first and foremost, as well as for the person you are caring for. So before I introduce our guests, I just want to say that there is still a stigma in our society about addiction that a lot of people don't want to talk about, So before we go, if there are any questions at this time or any comments, maybe you can let the people know, and you can ask a question at this time before I introduce Jenna. I said a lot.
Right. Well, thank you. And folks, if you would like to ask a question or make a comment, if you're on the phone, just press *6. And if you're on Zoom, you probably already know how to talk to us. Unmute yourself, or go to the chat room. I have a little website where I can see and I can call upon you. Anybody? You did a good job, Lucy.
Well, I have to tell you, Evelyn, that I myself, doing the research, was very surprised at, because we haven't really ever talked about addiction and caregiving. So it was a learning process for me, and I'm very, very excited to have Jenna here today. So welcome, Jenna, Jenna Labell, who has worked in the field of addiction. We're so happy to have you here with us. And so you're on your way.
Thank you. I appreciate you having me here today. Okay, so you can go to the next slide. And so before we delve into the signs and symptoms of addiction, I think it's important to define what addiction is. So this is to date my favorite, or I find the most all-encompassing definition that exists that I've seen so far of addiction from the American Society of Addiction Medicine. So I'm going to break it down for you in chunks. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, a person's environment, and their life experiences. So let's just pause there. First of all, addiction today is now understood as an all-encompassing disease. It's in the past, it was, as Lucy said, there was a lot of stigma and taboo around the topic. People often spoke of it as a lack of willpower, as some sort of weakness, as a selfishness. The truth is that it is a disease, like we would call diabetes a disease, although it manifests in a very different way, and needs to be treated as such. So here we see that in terms of this disease, it includes issues in sort of brain circuitry, that genetics can play a part in this, although are not responsible for it entirely, and that it also affects a person's life, personality, and all areas of their life become sort of affected by the disease of addiction. So that may be new for you to hear of addiction being spoken of as a disease, but that is the way that it should be spoken about. And the second piece of this says people with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. So that's hard to wrap your mind around sometimes, that somebody could experience so many negative consequences in their life to their health and yet continue to engage in a behavior that is compulsive. Sort of hard to imagine, but that is a hallmark of the disease of addiction, which makes it very different from other diseases. And we also know that people often, nobody wakes up one day and says, I want to be addicted to a substance, I want to become an addict, right? It's oftentimes a slow progression to something that ultimately takes over their life. And so typically people will engage in substance use or sometimes addictive behaviors as a solution for problems in their life. So to escape negative experiences in their life, to escape their reality, to distract themselves from, let's say, the difficulties of caregiving, to numb physical pain that they might experience or chronic pain that they have. And so, like Lucy said, that solution maybe works in the short term or sort of dull some symptoms. However, over time, that solution becomes its own problem in and of itself. And so the treatment for addiction, as it touches so many areas of a person's life and health and brain, is what's called a biopsychosocial model. So that means that treatment involves, best treatment typically involves medical intervention, psychological intervention, and support from a person's social environment. So it's quite a complicated disease and takes a multidisciplinary approach for best results. Okay, you can go to the next slide, please. So I just wanted to provide you with some statistics on substance abuse in the States. So this is from the National Center of Drug Abuse Statistics. 1 in 10 Americans over the age of 12 have alcohol use disorder. That is the medical term for alcoholism. 60% of Americans increased their alcohol consumption during COVID-19 lockdowns, and this was not specific to the US. We actually saw this in many different countries where the isolation and the disconnection from others led to sort of wanting this sort of escapism and increase in drinking. And of those individuals, over 45% reported that increased stress was the reason for increased drinking during these lockdown periods. So we're in a period now where we're coming out of all of that, but yet we still have a lot of the effects in the mental health side from that event that we all lived through together. And drug overdoses have killed almost 1 million people in the US since 1999. So oftentimes we think of addiction or someone who we would call an addict as, this a homeless person on the street, someone whose life is in shambles. But the truth is it touches many, many people, many loved ones. It doesn't discriminate between color, race, socioeconomic status. I mean, these people can be professors, they might be your siblings, they might be, they might also be on the street, but they might be somebody's child who's actually excelling in school. So it doesn't really, the image that we've had of addiction is actually quite stigmatized compared to what addiction actually really looks like in everyday life. Okay, you can go to the next slide. So what can you become addicted to? This is not an exhaustive list, obviously, but I'm not going to go through every single thing that you can become addicted to, but we'll start with some of the main ones. So on the left, we have substances. So alcohol is a substance that is highly addictive. Drugs, so this includes drugs that you would find on the street that we would call illegal substances, or legal substances like prescription drugs prescribed by a doctor can also become addictive, and specifically when people start using it not as prescribed or giving medication to someone who it was not prescribed for, this is when more and more issues can come up with prescription medication. Cigarettes, obviously, nicotine is actually one of the most addictive substances that exists, which makes it very hard to quit smoking. It's not hard for no reason. Caffeine is addictive as well, and you'll notice that different substances have different consequences or repercussions in your life. Having a caffeine addiction versus having an addiction to a street drug may have different consequences in your life. But it's important to note for you what consequences you feel like it's having on your life and impacting in your health. And then on the right, we have behavioral addictions. Again, not an exhaustive list. So behavioral addictions, also known as process addictions, are behaviors that become addictive and are very similar in the way that the brain responds to them as substances. So spending money sort of affects the reward system in the brain. And so similar to taking a drug, gambling, shopping has a very similar sort of brain circuitry that happens when you spend money and there's a positive response at the end. Cyber addiction, this is anything that sort of involves a screen. So like internet, video games, social media, applications on your phone, things like that. And we've actually seen an increase in this in the youth since COVID-19 lockdowns. And sex addiction, which also includes pornography addiction. Okay, you can go to the next slide. Thank you. Okay, so how does somebody go from using a substance to all the way having a full-blown addiction? So again, it's usually a process, and the best way to explain it is called the continuum of use. So continuum of use means it starts at one end and gets progressively worse all the way up until the other end. So let's start with experimental use. I'm just going to use alcohol as an example for most of these just to simplify things, but the same thing happens with behavioral addictions as well. So experimental use is using a substance or engaging in a behavior one time, two times out of curiosity, and never coming back to that substance again. So, drinking, let's say it's drinking alcohol or using a drug once or twice, and then never really returning to it, just experimenting with it, and it sort of stops there. That's experimental use. We would not consider that an addiction problem at this point, obviously. Moving up along the continuum of use, we have recreational use. So this is when you use a substance in your free time, and it's often with other people. So there's a social component. It's usually not alone at this point. And it's usually around a specific event or reason for using. So for example, you're at a wedding, so you have a toast with champagne, or it's New Year's, and so you drink with your friends, or it's a party, it's someone's birthday party on the weekend. And so you go to this event with knowing that that's a piece of, I guess, a celebration or whatever it might be. And you're using in a social setting, but you're not necessarily drinking before the event or after event. It's really specific to that event and reason with a specific group of people. Moving up along the continuum of use, now we have regular use. So this is where things start to get a little bit more subjective, less clear. And somebody could, at this point with regular use, have problematic behavior with a substance, or they could not. So for example, so regular use is when use becomes part of your regular routine. Somebody might drink a glass of red wine every Friday night with dinner, and that's it, right? They have their one glass of red wine Friday night with dinner. There's no negative consequences to their finances, to their health, to their relationships, right? It's not problematic behavior, but technically it's considered regular use. This person would not be considered as having an addiction or any sort of problematic behavior with this substance. However, somebody can also drink only every Friday night, but they drink to the point of blacking out and maybe wake up every Saturday with a hangover and a headache, and maybe the house is a mess. And so again, they may use in a routine manner that's only once a week, let's say, but the repercussions are a lot more serious in this person's life. So again, it's not about the frequency of use or the amount, although the amount does play a role in it, but it really is at regular use, what are the repercussions and consequences in your life? And then we move up all the way on the continuum of use to full-blown addiction. And the disease of addiction. So we can actually explore those signs and symptoms in the next slide. Okay, so signs and symptoms of addiction. Again, this is not an exhaustive list, but these are typically hallmarks of what someone experiences when they are suffering with the disease of addiction. So first of all, wanting to stop, but not being able to. So if somebody says, again, I'll use alcohol for all of these examples to simplify things. I really want to stop drinking. I find it's affecting my ability to work. It's affecting my ability to take care of my loved one. But somehow they can never actually get around to stopping. Somehow they always are back with a drink in their hand, or, never get around to actually quitting or throwing out the alcohol they have. And so that may be, that desire to want to stop, but never actually being able to follow through with it, may be a sign that addiction is at play. Loss of control over your use. So let's say you tell yourself, I'm going to go out tonight, but I'm just going to have one beer. But one beer always somehow leads to 2 beers, 3 beers, and maybe it moves to hard alcohol. So loss of control, not being able to actually monitor your use, and once you start, you can't stop, or it moves to something that you hadn't intended it to when you sat down. That might also be another sign of addiction. Changes in mood. So if you notice that over time, since you've started using a substance, let's say, or engaging in an addictive behavior, that since you've started really, like it's taken up a larger place in your life, that you have more changes in your mood, meaning you might feel more depressed, more anxious, irritable, have less patience with those around you, have less patience for the loved one you're caring for. And you really start to notice that this coincides with when your substance use has exacerbated or become worse, or that it's the longer you've been drinking, the longer you feel like these are getting, you know, more and more moody or more and more unhappy. That may be a sign as well. Physical changes too. So if you notice that since substance use started, you have more weight gain suddenly than you ever experienced, or weight loss, depending on the substance, or you notice changes in your sleep patterns, or you notice changes in appetite throughout the day, you know, feeling physically ill, feeling not as good as you did before, and it's unexplainable as to why. This also might be a sign and symptom that it might be due to substance use. Losing interest in things that used to give you pleasure. So if at one point in your life you enjoyed, let's say, exercising, socializing, whatever it might be, and now those have sort of fallen to the wayside, and what's replaced them actually is more substance use, or, you know, you feel like you want to isolate more, and isolation also comes with using a substance or an addictive behavior, sort of disconnecting from others, disconnecting from things that used to give you joy, and only sort of seeming to find joy or pleasure in your substance use. That might be a sign as well. Cravings are a hallmark of addiction. Cravings are often a physical, bodily sort of desire to use a substance. So when you're not using a substance, your body may feel like physically craving it. So when you're not drinking, let's say you feel like you can't wait until you have a drink or until you can get home and fulfill that craving. It also comes with psychological symptoms as well, sort of constantly having it on your mind and waiting to fulfill that need. Not being able to carry out obligations or fulfill responsibilities. So if you find that, again, if we use drinking here as an example, drinking is getting in the way of you carrying out your obligations as a caregiver, or fulfilling your responsibilities towards yourself or the one that you're caring for, or at work, this might be a sign and symptom of addiction as well. Trouble in relationships. So again, it depends on your relationships in your life, but typically people that struggle with addiction have pretty tumultuous relationships in their lives, or become completely disconnected and isolated from others. Sometimes people have told me that sort of a sign for them that they knew that they were engaging in problematic behavior was when it was happening more and more often that family members or friends were coming up to them and asking, like, oh, did you ever think of quitting? Like, are you sure you're good? How do you think maybe you have a problem? Which can be very triggering for someone who's not willing to face it as well. Spending a lot of time, money, and effort obtaining substances, using substances, or recovering from the effects of substances. So if you notice that a lot of your paychecks are going towards purchasing substances or engaging in addictive behaviors, and then a lot of your time is now taken up by using a substance, or when you do happen to have free time, because caregiving does take a lot of time out of your day for sure. When you do have free time, that is often what you're gravitated towards, and then maybe even recovering from the effects of it. So let's say if we use alcohol, you know, recovering from the effects would mean recovering from the hangover, recovering from the negative symptoms it might bring to you that evening or the next day. Tolerance and withdrawal. They're a little bit more on the physical and like physical responses that our body has to substances and behaviors as well, actually, but they come with some psychological symptoms too. So tolerance is noticing that when you that over time you need more and more of a substance to feel the same effect that you felt originally when you started. So whereas somebody might have felt some sort of symptom relief or some sort of euphoric effect from 1 or 2 glasses of wine, as they continued to drink regularly, they might notice that to get that same effect, now they need 4 or 5 glasses of wine. So that's your body actually gaining a physical tolerance to the alcohol. this actually happens with behavioral addictions also, which might be surprising, but it does. And lastly, withdrawal is when you are not using a substance that you experience actually negative effects. So for example, if someone is a long-time drinker of alcohol, and in moments when they are not using it or do not have access to their alcohol, they might experience headaches, trembling hands, nightmares, sweating. They may have nausea symptoms, stomach aches, difficulty with their appetite, moodiness, irritability. So this is really when there is very much a physical response to not having the substance because they gained tolerance over time. Okay, we can go to the next slide. Okay, so for those that can see this diagram, I'll try to describe it as well as possible if people can't see it. But this is a very interesting illustration that was taught to me many years ago about how addiction sort of develops over time. So if we look at the horizontal line, that's baseline, meaning that this is just everyday functioning. You're normal, neutral, able to function in your daily life. You don't feel amazing or euphoric. There's nothing like overly positive, but you just feel normal, everyday functioning. Above baseline is that euphoric, really more than just like positive feelings, above and beyond just everyday functioning, feeling euphoric, feeling physically good. Below baseline is the opposite, feeling negative symptoms, feeling not amazing physically, maybe feeling not amazing mentally. So baseline is neutral everyday functioning. Above baseline is some sort of high or elevated state above baseline. And below baseline is feeling not so well and negative. Is that clear what the line is?
Yes.
Okay. So just to let you know, this is with long-term use. So this process I'm going to describe to you doesn't just happen with 1 or 2 times of using a substance, but it's really with prolonged use of a substance or a behavior, actually. Okay, so the first time you use, let's say you see this little sort of ramp, this like little hump here that I have. You get to the top of it. I don't know if I could use like a cursor or. Anyways, it's okay. Yeah, so you get to the top of it. Yeah, you can stop there. And then you use a substance 1 or 2 times. You feel a high, you feel euphoric, you feel way above baseline. You're feeling good. And then eventually you come down off the substance and you come back to baseline. You might have a little crash below baseline where you feel like, okay, you're coming off the substance or behavior. You don't feel fully amazing, but it's nothing groundbreaking. It's nothing to be, that really alarms you. You come back to baseline and there's normal functioning again. And then after time, you continue to use the substance and you see the same increase above baseline, but you'll notice that the top of your sort of euphoria that you get over time is not as high as it was the first few times that you used. And anyways, it still is working. As we said, it's used as your solution. It feels good. You come back down. And maybe the crash this time after a few months or whatever the time is a little bit lower than you had anticipated, but you still bounce back to baseline, come back to normal functioning. And then again, you continue to use, but you start to notice that euphoric feeling, the pleasant feelings that you experience is again not as high as it was compared to originally when you started using. And now the crash below baseline is getting bigger and bigger, more and more negative consequences. And eventually you'll notice as you keep going that people start using substances or use substances just to get at everyday normal functioning. So this is where addiction lives. This, at the tail end here of this diagram, this is where people experience withdrawal. This is where people have tolerance. And this is where all the signs and symptoms of addiction typically live. So after long-term use, a lot of people are not even using a substance to feel some sort of elevated state anymore. A lot of them are just using it to feel normal, to get to normal everyday functioning. And this is oftentimes where you need that biopsychosocial intervention of medical attention and also a psychological aid as well. Any questions about this?
It's a great little graph. I love it.
Yeah.
I didn't make it up because someone taught it to me, so I won't take credit for it, but I think it is, it highlights a lot.
Well, you said an awful lot, and maybe we can give people, we received quite a few questions about this, but I'm wondering if the audience, if any of you want to ask some questions about what Jenna was saying, just to clarify things for yourself, or you can wait for if you stay on with us, at the end of the session, we'll have a more private place for you to ask questions. So
So if you'd
let's
like to
hear
do
from
it
you.
now, you can press *6 if you're on the phone, unmute yourself, go to the chat room. We'd love to hear from you. As I said before, it really enriches our podcasts when caregivers talk about how they feel about these things. Okay.
Okay, you could also put something in the chat if you like to. So we'll give you a few minutes to think about it. But as I said, we did receive some questions before, so I'd like to read them to you. I'm a caregiver for my mother who lives with me and my husband. Mom is 85 years old and has been diagnosed with Alzheimer's. She's a very pleasant lady. However, she needs to be taken care of daily. I'm so busy with all the things I need to do for her, my home, cooking, shopping, cleaning, and working on my relationship with my husband, who resents having my mother living with us. I did go to the doctor and told him that I was not sleeping at night and felt anxious during the day. He did prescribe some medication and it really helped. When I get anxious during the day, I started taking more medication than what the doctor told me to take. I don't want to stop, but I'm afraid that I may get addicted. Are my concerns real? Not sure what to do.
Okay, so should I start?
Yes, Jenna, sure.
So first of all, it takes a lot of courage to send something like this in and to ask for help and ask for, seems like this person's trying to make sense of what's happening in their situation. So I think that it would be important to probably speak with your doctor, first of all, because the doctor is the one prescribing the medication, and now it seems like this person is taking it not necessarily as prescribed, but for a reason. It sounds like there maybe is underlying reasons as to why. Is it helping with anxiety? Is it helping with feelings of depression? Is it helping as an escape? Is it helping stop panic attacks? So it would be interesting to understand, where is this coming from? Kind of what is this medication helping with at this time in terms of the psychological symptoms? So ultimately, I think speaking with the doctor first and foremost, getting more information about why this is happening, and then how to remedy the situation so that it doesn't become a more dangerous, physical situation for this person taking medication as not described. And maybe seeking your support, your own sort of support system, if that's confiding in a loved one to what you're going through, or if that's through professional counseling, that might be sort of a first place to start.
Thank you for that. And also, it's kind of reflective of what my presentation was in the beginning, of all the difficulties that caregivers go through. And, we always say, you don't have to do this alone. There's a lot of resources in the community that can help you. For example, this person may be just overwhelmed with too many things to do and needs support, maybe needs some respite. So again, I think it's the first thing when we feel something is wrong, just acknowledging it. And another good way possibly is to just sit down and write down, what do you need? What would help you right now? And as I said, there are resources, and we will share those resources. And the idea behind it is to really take care of yourself as well. So I want to thank this person very much for having the courage to write to us. If anybody wants to make comments or add about this, or anything that maybe that you've dealt with, the lines are open, the chat's open. You can speak up if you want.
Hi, everyone. I'm Allie, and I'm a Florida Atlantic University intern for social work. And I was referred to the program by my supervisor of the Area Agency on Aging. And what I have found is, in my stressful situations, I did care for my grandmother for several years during her decline of dementia. And through my personal growth and process, I found that mindfulness has really played a key. Is yes, there are external tools that I could use to relax myself and take a moment, but I find like just a simple breathing exercise like the 777, where I could just go inward and really just be with myself in that moment. And then you know, seeing my environment. There's obviously things that I do not have control over, but there are also things that I have control over, like, is the TV blasting? Is it like hot and agitating in my environment? You know, make sure the temperature is good. You know, maybe just play some soothing music that when the circumstance gets at a high level, I have that background music to remind me to go inward and just, you know, be calm. So I have found mindfulness has really played a key role in, you know, just everything I do, to be able to, you know, calm myself in the situation.
Thank you so much
Thank
for
you.
that. Thank you
Beautiful.
so much. Yes, I mean, there are lots of tools, and all these sessions that I do, and others that do it through the teleconnection, we talk a lot about these kind of tools. How do we soothe ourselves, staying in the moment, caring for ourselves, loving ourselves, taking breaths, going for a walk. These are all so important little tools that help us through difficult situations. So thank you again. I don't know, Jenna, if you wanted to say something on this topic.
Yeah, I think you're bringing up a really good point that is sort of like, what tools do you have in your toolbox in moments where you are sort of emotionally dysregulated, or you feel overwhelmed by your environment or your emotions that you're experiencing. And oftentimes with addiction, unfortunately, that is the one tool that people have in their toolbox, is to go towards the substance or towards the addictive behavior. And learning eventually through recovery how to add to your toolbox with tools like mindfulness, how to regulate your own emotions, how to calm your environment down, how to soothe the mind, how to talk back to critical thoughts, right? And so increasing your healthy and adaptive tools in your toolbox is a huge piece of combating addiction.
Thank you. So we have another question here, but I want to give people an opportunity if you want to say something or make a comment.
Go ahead and use the chat room or press *6 if you're on the phone. We know it's a tough issue, but
It is a tough issue. I mean, really, it really is tough. Okay, so let me go on to the next one. I've been taking care of my husband with dementia for over 3 years. Our children live out of town and don't visit often. Our friends are no longer visiting because Bob is not able to communicate and his table manners are not pleasant to watch. I take care of all his needs and I'm exhausted, angry, frustrated. I find having a drink before going to bed has been helpful. Lately, it seems that 2 drinks are better. I find that once I wake up in the morning, I'm not myself. I'm starting to think that maybe drinking is not the answer. I'm too embarrassed to tell anyone and ask, what should I do? Thank you for that. That's take a lot of courage to actually look at yourself. And I believe it's the first step possibly to getting some help. What do you think, Jenna?
Yeah, I mean, unfortunately, in addiction, there is a lot of shame. Like this person mentions embarrassment, but there's nothing shameful in acknowledging that you might have problematic behavior, and there's nothing shameful in asking for help. So it does take a lot of courage to send something like this in. So thank you for sharing. You know, just in terms of some of the material we touched on, we see that alcohol may be used here as a sort of coping mechanism and that it's being helpful for sleep. We see maybe some tolerance happening too also, that 2 drinks are becoming better than the one that the person started with. So again, it's sort of acknowledging what are the consequences that this is having in your life and asking yourself if this is something you want to continue or if it's something you'd like to change. And if some of your behavior is actually scaring you, that could be a sign that maybe this isn't the right coping mechanism for you. We'll have resources at the end after we finish the presentation, but there are free support groups like AA and other types of groups that have a pathway to learning how to recover and where you don't actually have to do it alone. So having some community around you, helping you and supporting you, that might be a first step as well.
And again, I mean, it's overwhelming being a caregiver for many people. And the fact is that, as I'm going to repeat myself again, nobody needs to do this alone. There's a lot of help out there.
And you have to take care of yourself first. You've got to make yourself number one, or because you can't take care of somebody else if you're not really taking care of yourself.
100%. And the fact that this person, that she's waking up in the morning and feeling not great, and how do you function? And the risk factors that are involved with that. If you can't function when you get up, there's another person who's depending on you. And you have to make sure that you don't put that person at risk, and yourself as well.
And Jenna, I noticed that when you were talking about the signs and symptoms of addiction, there's a lot of crossover with depression.
Mm-hmm. Yeah, I mean, oftentimes addiction, actually, I will say with full confidence that addiction does not live in isolation. It usually happens with some form of anxiety, if not a full-blown disorder traits, with depression, with other mental health issues. So absolutely, it's almost impossible to be struggling with something so severe in your life and not experience negative emotions. So yeah, it typically is, like Lucy said earlier, or for a lot of people, it starts off as a self-medicating of some of those symptoms.
So the woman who wrote in might also want to consider some personal therapy, because she sounds angry, she sounds depressed, and she admits those things. And I think being able to, develop some techniques of dealing with that may be the techniques that she needs to deal with what she sees as a problem.
Absolutely.
For sure. Thank you. Just looking at the time, so we have a little bit more time for one more question, as I do have one. I'm a caregiver for my family member. When COVID started, we both had to isolate ourselves. I started ordering food and other household supplies over the internet. I then started to play games on the computer, and it brought me some peace of mind. Once things settled down, I still found myself more preoccupied with the internet and started to buy things that I really did not need. Things started to pile up in the house. I feel that I'm neglecting my duties as a caregiver, and I'm neglecting my needs as well. I can't seem to stop using the internet. I saw your program advertised and decided to write. I have to say, I'm beside myself, embarrassed, and feel totally out of control. My life is turned upside down. Oh my goodness, that's a big one. That's a really heavy one. There's so many issues here that need to be looked into. My concerns is the risk factors of possible neglecting the person you're caring for and yourself. But I'm going to let Jenna speak to that. And then if anybody else wants to add something, we would appreciate it.
Well, I mean, we see here that behaviors can become addictive as well. And it's actually really big that this person acknowledged that, because sometimes we just think as addiction of just with substances, but acknowledging that maybe this behavior is causing negative consequences in your life does take self-awareness as well. And we see here that ultimately this behavior is having negative consequences in this person's life, and possibly for the person they're caring for. There's also financial debt from the shopping online that's being created here. So acknowledging that you have a problem really is the first step, acknowledging that this is maybe not sustainable behavior, maybe not even in the short term and definitely not in the long term. I mean, just some, some ways that people deal with addiction for shopping, let's say it is online or for gaming, is first of all, limiting access to certain websites, deleting games off your phone, but really getting, those are like technical sort of practical ways that you can limit your access to it, but underneath that there's hurt and there's pain and there's a reason why you're going towards this behavior. So maybe confiding in someone who feels safe, and who maybe that, sharing that will already create some accountability in you wanting to, make a change. There are also support groups and support centers for behavioral addictions, which a lot of people don't know about, and seeking professional counseling too, because underneath this behavior is somebody who is struggling to deal with their life and negative emotions that they might be experiencing through the reward of purchasing items or the reward of winning the game. And so that has to be explored ultimately.
And I can't tell whether this is a man or a woman. They're sort of, because they don't really mention that, and it's a family member they're caring for. And maybe as a caregiver, you may no longer be able to care, and that's okay. And to allow yourself to speak with someone, with a social worker, or a counselor, to talk about, maybe it's time. I don't know what the needs are. It might be too much at this point for you to carry on. So you're kind of shifting your needs towards something that's kind of in the moment rewarding, and kind of not wanting to cope with what's going on in your life of either caregiving. I don't know personally how you are. Are you well? Do you need, so all these things need to be taken into consideration. Being embarrassed, you don't need to be embarrassed. We're only human. We're only human. And sometimes our needs just are so great at that time. Too much is going on in our lives. We need to be able to step back and be able to look at what's going on. And the fact that you even wanted to get an answer tells me that you're kind of ready. So I want to wish you all the best. And the AAAs, right, Evelyn? The
Agencies on Aging, yes.
So I actually just have 2 last slides before we move to the resources.
Sure.
Just about if you recognize yourself struggling with an addiction, or if the person you're caring for may be struggling with one. I don't know if we could pull up the slides one last time.
Is Minerva, are you still with us? I think you'll have to do it by heart. Oh, there she is.
Okay, so just briefly, if you notice that maybe the person you're caring for struggles with addiction, first of all, this is difficult because it may be a long-standing issue for them, and also depending on if they have cognitive difficulties, or maybe to communicate, that might affect how you approach the situation. But if you feel it is safe to approach them, and you are able to maybe communicate your concerns with them, perhaps gently approaching the person about your worry for them and their health, and how it may be unsustainable for you as well to continue enabling this behavior that ultimately may be harmful for the person, but for you as well. Speaking with the person's family doctor about your concerns about them may be an appropriate course of action to figure out how maybe we can find treatment for this person. Oftentimes, and I think this is an important point, we might think that, just removing the substance and not giving it to them anymore would be the answer. However, this can be really dangerous. So if somebody, let's say, is a long time alcoholic, just cutting off cold turkey alcohol can be extremely dangerous and actually deadly, more so than other substances, which a lot of people don't know. And so you really need medical intervention to wean it down slowly at an appropriate level. And so involving a medical doctor would be ideal. Same thing for if prescription drug use is not being taken as prescribed, that needs to be weaned off appropriately with a doctor as well. And engaging in your own self-care, like we've mentioned multiple times now, it can be very difficult watching a loved one struggle with an addiction and very painful. And so seeking your own support to talk about what you're living through and watching your loved one suffer is a piece of self-care to help you and ultimately your family member or the person you're caring for. And then lastly, in the next slide, if you feel like you identified with any of the signs or symptoms today, first of all, recognizing that you might have a problem, as we mentioned now, is really the first step. It actually is one of the harder steps out of any piece of the treatment. And asking yourself, do I want to change? Is this sustainable? Is this behavior sustainable for me? Is it sustainable for the person I'm caring for? And if your answers to the question, do I have a problem, is that a yes? And do I want to change? Is that a yes? Well, then reaching out for help is ultimately where you may have to turn to, and you're not alone. It's very, very difficult actually to tackle this disease alone. And it's very scary, and you don't have to do it alone. So confiding in a loved one, finding a support group, of which there are many free ones in most cities. There are abstinence or reduction-based programs that your doctor may know of, or your social worker, and maybe even seeking out your own professional counseling or therapist. So with that, I will leave you to the resources. Thank you again.
These are the references, but you will get resources. I know we're kind of pushing the limits, and Evelyn always has something to say. So what we're going to do is, once Evelyn tells us a little bit more, we're going to take a 2-minute break, and then we'll continue until 11:30. Go ahead, Evelyn.
Thank you, Lucy. I always have something to say.
Yes.
That was good.
We appreciate
it. So for those of you who are still on the line, in several days, you'll be getting a post-session questionnaire with the resources attached to it. That last slide you saw, that will come with it. And if that's only if you're registered for today's session. If somebody gave you the link or gave you the phone number, to call in, you need to call our customer service desk and get registered. And you'll be really happy you did, because you not only will get those resources with the post-session questionnaire, you'll also get the monthly calendar from now on, which is full of fabulous stuff. I want to thank our expert speaker who did a really beautiful job, Jenna. That was very clear, very understandable. It was great. I also want people to know that we have many good presentations coming up left this month. Normal versus not normal aging, behavioral disturbances in dementia, suicide and aging, combating compression fatigue with mindfulness. Thank you, Lori, Allie. And let's see, caregivers, time to say goodbye, how to eliminate toxic people, understanding grief and loss. And we have 2 more in the series that dear Lucy and Elliot Montgomery Sklar are doing on how to handle uncertainty and how to process sadness. So if those sound interesting to you, please sign up for them. We look forward to seeing you in the future. And I just thank you, Lucy. Thank you, Jenna. You have done such a good job in really explaining very simply and clearly, what we need to know here. And what is the website or link to listen to the podcast recorded? In a couple of days, it will be on there. It is www.caregiverteleconnection.org. And we hope very much that you folks will be able to take advantage, refer people to it, go back to it, whatever you would like to do with that information. And with that, I am going to close the recording. I would like to thank the WellMed Charitable Foundation for sponsoring the Caregiver Teleconnection. All of these sessions putting them on their website, a great website, the SOS clinics that they have, and also their Stress Busters program and everything else. They do so much. So thank you all. I'm going to stop the recording, but we are going to come back in 2 minutes. Please take time to get yourself a fresh cup of addictive caffeine. It's
Or go to the Toity.
That's pretty addictive.
All right. Now, even if there's one person that's left, we are going to be here for you. So see you soon.
Okay. Bye-bye, everybody.